You are listening to the Berman Method podcast featuring Dr. Jake Berman and Jenni Berman, physician assistant, where we treat problems, not symptoms.
All right. We are live and recording podcast number 1. My name is Dr. Jake Berman of Berman Physical Therapy, and I'm here with my lovely wife,
Jenni Berman, physician assistant, owner of Berman Health and Wellness.
All right. And I specialize in helping people age 50 plus keep active, mobile, and free of pain medicine, even when their doctors and their kids are telling them, just take it easy, you're getting old, come on. And what do you specialize in, Jenni?
I specialize in helping individuals 50 plus to reach their goal weight, improve their gut health, and to remain active without medications.
All right, that sounds pretty cool. So why the heck did we decide to do a podcast? Why do we think that there's anybody in this world that is willing to dedicate their quality time to listen to what the heck we have to say? Why are we doing this?
Well, the Berman method is really important, but why is it so important?
What the heck is the Berman method?
The Berman method, that is me and you together.
Okay, so some more details on the Berman method is it's essentially something that we created over the years where we're focusing on treating problems, not symptoms. We're going to get into that a little bit more as we get into this podcast. However, the reason why we wanted to start this podcast in the first place is because we are pissed off. We've got a broken medical system here in America. And most people know it, where the insurance companies, the premiums are going through the roof, the big pharma or the pharmaceutical companies are charging an arm and a leg, and healthcare costs are shooting through the roof. The problem is that these healthcare costs are associated 99% of the time with treating symptoms, not problems. For example, you take a medication to lower your cholesterol, and then you have to take another medication to treat the symptoms that first medication caused. Then you have to take another medication to treat the symptoms that second medication caused. So here we are, a couple of years down the road, and you're taking at least 3 medications that are all treating symptoms versus what the heck causes cholesterol to go up in the first place. Jenni, please tell us more.
Why can't we just change our diet? Why can't we just eat a little bit leaner? It doesn't have to be boring, but eating a little leaner, a little less of the bad fats and eating more of the good fats to lower our cholesterol. Then I don't even need a medication.
That would be too hard though, because that is not the easy pill, right? We as Americans are lazy by nature in general. That is a very big generalization there. But if we can just take a pill to fix our cholesterol versus changing our diet, we're going to jump all over that. And that's what got us into this problem in the first place.
It's true, but to defend the patients a little bit, a lot of it is needing to know the knowledge. The patients need to know how they can improve their cholesterol without the medication, but because of the healthcare system, the physician assistants and the physicians, the DOs, they don't have time to discuss that with the patient. So it's easier on both ends to say, here, just take this medication.
What do you mean they don't have time?
Well, that goes back into the insurance world. The insurance not going to reimburse us for educating the patients on the right diet, and we have to see so many patients a day to even break even. So unfortunately, at this point, the insurance has been dictating what we can and can't do to help individuals.
So this is a very brief introduction. We're just barely hitting the tip of the iceberg here. However, this brings us back to the original point that we are David against Goliath. We are against the corporate medical system. We are trying to do whatever we can to make ripples turn into waves and try to change the system through education. Because Jenni's absolutely right, where it is an education thing where you have a problem, you go to the doctor. But because the doctor doesn't have enough time to sit with you and educate you, because the doctor does not get reimbursed for billing education, they just say, here, take this medication and it will treat this symptom. Because I have to see 20 patients today, 30 patients today. How many patients an hour?
Well, it really depends on the area, but sometimes PAs and MDs can see up to 10 patients, in the first 2 hours that they're working. They could be seeing 6 patients an hour at times. They could be seeing 30 to 34 patients a day.
What? How in the hell are you supposed to find what is really going on if you have to make a decision, make a diagnosis, and make a plan of attack, prognosis, diagnosis in less than 10 minutes? And most of the time, it's the first time ever meeting somebody. How can you possibly get that right?
Right. It's challenging. That's why we just want patients are looking for quick and easy. The MDs only have time for quick and easy. It's very challenging. So we are here to get past that, to really help individuals find the problem and how to fix the problem in a more natural environment. So my practice is actually focusing on the internal, inside the gut, the metabolic disease, the systemic issues that are going on inside the body. And then I can turn it over to you to help the outside of the body.
Right. So systemic is what happens inside. Systemic is your organs, that's your guts, that's all the stuff that happens internally. Versus the external is the physical component. That's where I come in. My back is hurting, my knee is hurting, my hip is hurting, my neck is hurting. Oh man, the achy back, it's just getting worse, and they attribute it to getting old. So to make it make sense, I want everybody listening to this to know that this is going to be geared towards my demographic, the people that I see the most. We are out of Naples, Florida, and the vast majority of the people that we both see are over the age of 50. And I would even say over the age of 60. However, they're active. We see a lot of active people over the age of 60. So in general, that is going to be the demographic that I'm gearing this towards. So remember, if we say something that you don't agree with because it doesn't fit the mold of somebody that's 20 or 30 or 40, mainly for me. For Jenni, it's a little bit different because the systemic issues, it really doesn't matter if you're a teenager or 90 years old. She literally works with that wide of an age range. Versus me, the things that I'm going to be saying on this podcast are going to be really geared towards somebody that's over the age of 50, even over the age of 60, that's trying to keep active, mobile, and free of pain medicine.
Now, you help individuals at that age, but we also see, which can be a lot of aging or long-term injuries, different things that have happened. But we also have seen a lot of times that if we can just improve their gut health and reducing inflammation, that also helps with their symptoms too, with the problem.
So are we talking about physical or the systemic stuff now?
Well, the systemic stuff can cause some physical ailments.
What? What did you just say?
Systemic inflammation. So starting with the food that goes into your gut, and your gut health can actually cause the symptoms of the physical ailments that your patients are feeling. Is that right?
So you're telling me that I could be working on somebody for back pain and beating them up, doing the soft tissue massage to the muscles, getting the muscles firing, exercising, getting everything stronger, trying to fix their back pain, but it's really something that's going on internally?
It certainly can be. Of course, that doesn't go for everyone, as we discussed. There are injuries that have happened and long-term golf issues that have gone on causing the problem physically. But a lot of times, yes, the systemic internal, what you're eating can affect your physical pain.
Okay, so the point of that is we just want to let everybody know that's listening to this that this is not a one size fits all or even most strategy. This is something where we really dig into it piece by piece, individual by individual, and try to figure out what the heck is going on here. Is this really a physical condition where we have this limitation? We've got a weakness that's causing another part of the body to be overworked and underpaid? Or is this something that's going on internally where there's many times where something going on with an organ can refer back pain? And we've got to figure it out from the inside out, not the outside in. So that's where we have decided to team up and say, let's team up and let's just hit this thing from every single angle, because it's really hard to have one without the other. It's really hard to have a physical condition and not have a systemic condition, and vice versa. If you got a systemic condition, it's hard to not have a physical condition, because if your stomach doesn't feel good, if you're having a leaky gut symptom, or you're having a gluten intolerance, or it doesn't matter what it is, then you're not going to feel great. If you don't feel great, you're not going to move the way that you should. You're not going to be able to get out there and exercise the way that you should. So it's hard to have one without the other.
And that's a very good point, coming from the other side of it, things that I see. Right now, I'm actually working with a mom of a 2-year-old who came to me because they are having terrible skin rashes, hives, eczema, a lot of stuff going on. She's been on dozens of medications and creams at only 2 years old. The dermatologist, the allergist, the pediatrician just handing her, try this cream, try this medicine, try this, try that. She came to me because she's like, I just can't put her on any more medication. We have to figure out where this is coming from. It's coming from her gut. We made some very simple changes in her diet, and already the hives have improved. The rash this has been gone longer than it has been gone in 18 months that they've been experiencing this. So it's just amazing how these little changes can have such a huge effect on somebody as little as 2 years old, but all the way into their 60s and 70s.
So let's run with that a little bit more, because I gotta admit, before I met you, my beautiful wife, I honestly did not believe that gluten intolerance or gluten sensitivity was a real thing. I really didn't, because my logic or my rationale was gluten's been around forever. Why all of a sudden is this thing getting so popular now? Is this just a fad thing? Is this just another thing where people are looking to be cool, or this is the popular thing? And it wasn't until I met you, and we'll get into this story a little bit more on episode 2, I believe, is when we're going to talk about this in more detail. But it was not until going through that experience with you that I realized that this is not a fad. This is not something that people are making up. This is a real thing that is happening. And just to, again, to get on the tip of the iceberg, my explanation with the extensive research that I've done on it is it's attributed to all these GMOs and how all of the food that we're eating today is so genetically modified compared to the food that we were eating even just 30 years ago. But let's go even back further. Let's go back to the 50s or even the 40s, where GMOs, genetically modified food, was not even close to as prevalent today. I don't even know if it was around. I need to do more research on that. But think about it. You're taking food and you're genetically modifying it so that it's bigger, so that it produces more. So the food is not the same anymore. On a chemical level or cellular level, it's not the same anymore. So your body has to respond differently, because the digestive system that's been around forever, right? It's not used to trying to break down this genetically modified thing that you just consumed, this chemically injected piece of burger or whatever you're putting into your gut. So that's where these things are coming out. When people are having these systemic symptoms where they've got eczema, or they've got this upset stomach, or they've got bloating, they've got this spare tire going on around their midsection, or what are some other symptoms that people don't even attribute don't even consider could be an option from gluten sensitivity, for example? What are some other things that are under the radar that people are just getting medicated for?
Right. Arthritis, rheumatoid arthritis, lupus, Hashimoto's disease, which if you have it, you know it, but that's an autoimmune thyroid disease. So hypothyroidism. A lot of times people will get their lab work done and say, oh, you have hypothyroidism, take this medication. When it isn't taken the next step of identifying, do you have Hashimoto's disease, which is actually the autoimmune version of hypothyroidism. And Hashimoto's disease is actually caused from food sensitivities and leaky gut syndrome. So now you're just taking this medication without even being tested that one step further. So that's a very popular one. Well, I shouldn't say popular, very common one. Things like psoriasis, which is a flaking of the scalp, which, people will say, oh, it's just dandruff, take this medication or use this cream, when really that could be coming from your food. Leaky gut or irritable bowel syndrome, this could be with diarrhea or constipation, is very, very commonly coming from the gut. Ulcerative colitis, Crohn's disease. These are all things that happen to the gut, which are coming from your food sensitivities. I mean, the list of autoimmune disease could go on and on, when really the culprit of all of these different things is your food, your gut.
Okay, so you just mentioned a ton of different things. And the thing that I want everybody listening to this to realize is every single thing that Jenni just said is being treated with a medication. So these people are going to their doctors and telling them about these symptoms, the irritable bowel, the diarrhea, the Hashimoto's symptoms, and they're getting prescribed a medication to treat those symptoms, opposed to let's just figure out why this is happening in the first place and fix that problem. So you mentioned something right when you started going off on that rant on all of these symptoms that are going on. Arthritis. So we're talking about arthritis can be caused from a food sensitivity? Are you freaking kidding me?
Not kidding. Can you even believe it?
Well, let's make this make sense, because here's one thing that a lot of people don't know is gluten is a sticky protein, right? Mm-hmm. So gluten is a sticky protein. I'm pretty sure that everybody listened to this at one point in their life or another, as a child, was told don't swallow gum. Right? That's a pretty common thing. You're a kid, you're 5 years old, you're chewing gum, walking around minding your own business, and your parent says, don't you swallow that gum. Why would they say that?
Well, we don't want it to stick to our gut.
What?
I know, it's crazy.
You don't want the gum to stick to your gut. I want everybody listening to this to think about gluten as the same exact thing happening at a micro level. Gluten is a sticky protein. So you go out there and you eat a pizza or a big sandwich, that is getting digested and broken down into tiny pieces of glue. I want you to put that vision into your head. Now, all that glue is going to be sticking all around your intestines. Now, what happens? Jenni, tell us just real briefly, don't go into too much detail. What happens when we have a piece of glue or gum? What happens when that sticks to the interior lining of our intestine?
Well, the intestinal lining breaks down. It can't handle it. It's kind of like if you step on the piece of gum on the road. What happens? It digs into there, breaks up a little bit, but then it's just stuck there. Well, the intestinal lining breaks down, and this causes the food particles to be able to pass through and get into the bloodstream.
Okay, so it's an actual breaking down of the intestinal line. However, let's go even just a step before that. The breaking down of the line, does that create an inflammatory response?
Well, this is requiring a lot more detail. So,
Let's just say in general, just in general.
At the end of the day, yes.
Right, because the body is perceiving something is occurring in the GI tract that shouldn't be occurring.
Essentially.
Okay, we're just very surface level. Jen, you should see the look that Jenny's giving me right now. She's going, "Oh no. Oh no.
This is a can of worms.
This is a can of worms." We're just going very general right now. And just imagine you swallow a bunch of gum. The gum sticks to your intestinal lining. Your body knows that it's not supposed to be there, so it creates an inflammatory response. What is arthritis? This is where I'm going with this. We're bringing it back full circle. What is arthritis? Arthritis, literally, in Latin, is inflammation of bone. So inflammation of your joint. That's what arthritis is. So if we're already having inflammation internally, it's so easy for that to be transferred externally into the bones, into the joints, which leads to arthritis. So we're coming back full circle to say things that you are eating could be what is causing that knee to get arthritic, could be causing that hip to start going out on you. So again, this is very general. We are just getting the very tip of the iceberg here. The point of this podcast is we're going to take specific situations and we're going to go into the weeds. We're going to break it down. We are going to make it make so much sense because it's not a big, scary thing out there. You should be educated on this. There's so many people that we come into contact with every single day that think that they are not intelligent enough to understand how to heal themselves. So they have to take the word of the doctor, which is okay if you have the right doctor. But if you have a doctor just because that's the one your insurance pays for, and that doctor has to see 30 patients a day, it's highly unlikely that that doctor will be treating your problem. They will be treating your symptoms, most likely. So we're going to start to wrap things up here. This is just the tip of the iceberg. Episode 2, we're going to go into the details of how we came up with this philosophy. How did we come up with the Berman method? How did we switch gears from both of us working in the corporate medical system and believe in that philosophy? How did we shift gears into saying, that's not the right thing. Maybe we should be looking at this thing a little bit different. How's that sound?
Sounds great. I'm excited for episode 2.
Okay, so these things are just going to get better as we go through this. This was our first run. Thank you for staying with us the entire 23 minutes or however long it's been. It's going to keep getting better. You're going to get smarter and you're going to get healthier if you keep listening to this. So that's all I got to say about that. Until next time.
See ya.
Woo!
For more information, view the show notes where you can email us, visit our website.